helping make your life easier. Moms every day.
Good afternoon to you, everyone. Thanks so much for joining us here for Moms Every Day. We're joined today by Dr. Robert Hess with OVP Health. Dr. Hess, great to have you with us today. We really appreciate your time.
Thank you. Nice to be here.
Well, so interested to hear about the services that you offer with OVP Health, and I want to talk to you specifically about this COVID-19 pandemic. It has shaped our lives in so many ways, especially in the business world, causing so many companies to really have to make some significant changes to the way that they operate. How has it changed the way that you've provided medication-assisted treatment to the patients that you serve?
The biggest change was really in the use of telehealth. We had a program in place for about 3 years prior, did not really use it very much, kind of always one of those, what are we going to do with this? Well, the day the pandemic hit and they shut down the world, we flipped a switch, and this is a population there, if we had not been able to provide services, very high risk of overdose and death. So we had very little drop off in the number of patients. All the offices were set up to be able to provide it. Patients were instructed on the app to download on their phone, a secure app to provide the service.
And I know you were still able to offer those counseling services to those who were battling substance use disorder as well.
Yes, the counseling, as I tell all the patients, the counseling really is the treatment. The medication is just something to stabilize them and allow them to get their life back. The counseling is where you delve into the deeper issues, and all the patients will tell you that's where they benefit the most from, is the counseling.
Well, and when we're talking about those that are dealing with substance use disorder, just having someone to talk to, it is a lifeline in so many instances. How are you able to kind of adapt telehealth to really fit the needs of the patients that you serve?
Well, I think the biggest area, again, was the fact that we could reach out to them. Also, where a lot of the offices, we have some that are in more populated areas. In the rural areas where it's difficult for people to be able to get to the office, they could actually just do it from home and log on with the counselor, log on with the provider. They would still have to come at some point to get into the office to do their drug screens. But it just gave us a lot of flexibility. It also reduced, at a time when we wanted social distancing and people stay, waiting out in their cars before coming into the office like all doctors' offices were doing. It just gave us a lot more flexibility to keep people apart, try to cut down the transmission of disease, and we were very fortunate. We provided all of our employees with all the equipment, protective equipment for it, and to my knowledge, I think we only had 2 that became infected, and none through the office that we know of.
Very low numbers, which is wonderful. Do you believe that telehealth has become just as effective as seeing a patient in person in this situation we've been faced with?
It has. Actually, if you'd asked me that question 5 years ago, I'd have said no. But now with the advent of digital stethoscopes, otoscopes, you can get the whole history, the physical basically, with an advanced practice provider in the office. They can use the stethoscope for us if they need us in consultation. But particularly, again, for the counseling, that's not a hands-on type thing. The counselor can talk with the patient, and as you said, give them a level of comfort.
And Dr. Hess, I know you said that OVP Health was already implementing telehealth services to your patients before this pandemic hit. Have you at all expanded the use of telehealth during this pandemic? And has it opened your eyes to a realization that telehealth is here to stay for the future?
No question. I mean, it is here to stay. We expanded it in a large sense. We recently were awarded a grant to expand it further. So in terms of usage, there's maybe a few offices. As the pandemic began, every office was involved in telehealth.
Right. And as far as OVP recently receiving that grant that you just mentioned, it was a $400,000 grant from the USDA meant to specifically improve your telehealth capabilities in the region. Can you tell us how you're going to use that grant money, and also how is it going to improve access for those who are living in remote or rural areas? I know you said that's an area you're really trying to focus on.
Right. Yeah, the grant itself is actually, it was $430,000. We are matching that with $70,000 ourselves.
Wow.
And what that will provide is basically, you can kind of think of it, each one of our offices will become a hub. In each office will be a room dedicated to telehealth. It'll have an 86-inch screen, state-of-the-art equipment. So not only, though, can we provide the service to the patient, but we can also use that as a telehealth center for a person in a rural area to, say, see a specialist in Huntington, who otherwise would be a long drive from Williamson, Logan, to get to that provider. That specialists can then decide whether or not they need to see that patient, recommend maybe they need labs drawn to have them forwarded to us. So it's that collaboration that now we're bringing the specialist to the patient, not the other way around, which has been the traditional medicine role.
And Dr. Hess, before you leave us, one final quick question for you. I know one of the key distinctions with OVP and health addiction care is that you not only provide medication-assisted treatment and counseling services, but you also provide that medical care to those patients as far as their, occurring health problems that they have, the reoccurring health problems. So is it common for patients with substance use disorder to have other medical conditions that you see that need that treatment?
Oh, yes. I mean, it's kind of ironic, my late partner and I, when we started about a decade ago, we started an assisted treatment program in a family medicine office that we already had in Gallipolis, Ohio. While we have become known for medically assisted treatment, at the core of it is still primary care, family medicine. And in terms of other diseases, I mean, there are diseases that are more specific as a result of substance use,
Sure.
hepatitis, endocarditis, but it's no different than anybody else, the high blood pressure, diabetes, and this is a population, again, that oftentimes has to seek out emergency room care to get that. Now they can get it in our offices. All the advanced practice providers that are there. And again, if they have a question, they can contact, each one is assigned to a physician. They can contact us, and we'll have a setup in the corporate offices downtown here where we can just log on if it's something we need to take a look at and be able to do that from here to all the rural areas.
Dr. Hess, great to have you with us today on Moms Every Day. We appreciate your time and talking about how you've really adapted in this pandemic and the services you offer. Great to see you.
Thank you very much.
Thank you.
Appreciate it.